Hello, and thank you for checking out my presentation for the final project for HAP671. My name is Megan Krogmeyer, and this video is prepared for the Health Informatics program at George Mason University. Each year, more than 1.5 million Americans are diagnosed with diabetes. Statistics from diabetes.org state that in 2018, 10.5% of the population were diabetic. Also in 2018, over 21% of adults with diabetes were undiagnosed. A discussion of a study done by Digital Health in 2018 stated that diabetes represents a truly data-rich pathology with a wealth of routinely collected data, including but not limited to average blood glucose, foot health, eye health, cardiovascular health, and renal health. Diabetes therefore represents a pathology particularly able to benefit from the use of EHRs in research. The data used in this presentation is simulated data from a major healthcare institution in the United States. The number of unique patients and number of records are listed below. An important note is that the data has been cleaned up. Patients with diagnosis age of null, patients with duplicate diagnoses, or diagnoses after date of death have been removed. Diabetes is defined by deploying the CCS categorization scheme to International Classification of Disease, ICD-9 code, diagnosis codes to identify diabetes. This scheme collapses over 14,000 diagnosis codes into roughly 250 categories that are more useful in health data analysis. A comprehensive set of diagnoses were used to predict the presence of diabetes or the risk factors for diabetes. From our data, there are over 5,000 diagnoses that were observed more than 29 times. There is no gender bias for diabetes, meaning that a person of any gender has the same risk. A larger majority of people with diabetes are in the age range between 45 and 64 years of age. There are quite a few obvious risk factors for diabetes that have been discovered. Some of the top predictors include having high blood pressure, having immediate family members with diabetes, frequent urination, and being overweight. In order to find rare diagnoses that are predictive of diabetes, I found the top 10 ICD-9 codes that co-occurred with diabetic patients at least 29 times. A few rare predictors include fracture of upper limb, aneurysm of renal artery, and chills without a fever. This slide shows the top 10 ICD-9 codes that happen to co-occur with the diagnosis of diabetes. The top 3 important predictors here are hypertension, tobacco use, and gastroesophageal reflux. With the likelihood ratios of all ICD-9 codes, we can then use the naive Bayes classification algorithm, which assumes that the presence of a particular feature in a class is unrelated to the presence of any other feature, or simply calculated conditional probability. The total risk is calculated by multiplying all likelihood ratios together. For an example, patient 63 from the dataset has 5 diagnosis codes. If we multiply the likelihood ratios together, the risk is approximately 2.11. For cross-validation of calculations, 80% of the cleaned data went into a training dataset, while 20% went to a validation dataset. Cross-validation is important for verifying effectiveness of models. A receiver operating curve can be used to report the cross-validated accuracy of the predictions from the model. The ROC curve shows the trade-off between sensitivity, or true positive rate, and specificity, or 1 minus false positive rate. To compare different classifiers, it can be useful to summarize the performance of each classifier into a single measure. One common approach is to calculate the area under the ROC curve, or the AUC. In summary, using a predictive model can be used to screen for diabetes and screening high-risk individuals. Electronic health records contain a lot of data that machine learning techniques could be used on. This idea is not widely used yet, but with the appropriate testing and k-fold cross-validation, predictive models can be very useful. It is important to note the accuracy highly depends on the correctness of the data entered into the AHR.